Hello, my name is Andrew Schroll, and I'm with the FANA RORY group. And in 60 days' time, the governor of Florida is going to be making an important decision whether or not to opt out of the physician requirement to supervise CRNAs. So for the next 60 days, our team has developed an advocacy action plan, which we're going to present to you now. Please enjoy.
Hello, my name is Natalie Cruz. I am a member of the FANA RORY group, and I am here to discuss our advocacy action plan for Opt Out Florida 2018. It is meant to be done over a 60-day period. The timeline of those activities will be discussed later. I am here to outline, the points and what consists of each stage of what we plan to do. So first of all, I started by identifying the problem or the issue. And the problem is basically the November 13 rule. So just to give you a bit of a background of what it is, of a reminder, if you already know, the November 13 rule is also called the Physician Supervision Rule. And this is a rule that the Centers for Medicare and Medicaid Services, CMS, published in the November 13, 2001 Federal Register, a final rule concerning the federal Medicare and Medicaid physician supervision requirement for certified registered nurse anesthetists, CRNAs. The federal requirement to now has been that CRNAs must be supervised by a physician, any physician, doesn't have to be an anesthesiologist. The November 13, 2001 rule allows states to opt out or be exempted. These terms are used synonymously in the rule from the federal supervision requirement. The governor alone can determine whether a state is going to opt out or not. I mean, just a simple letter. It is not legislature. It is not voted on. And that's something that I want to stress. It is not legislature. The other problem is, that Florida has yet to opt out. The main goal is to get Florida to become the next opt-out state. To date, there are 17 states that have opted out. So we need to become that next state. Next step would be to identify the target audience. And in our subcommittee, we are asked to focus on sRNAs and CRNAs. Like I said, this is not a bill. We do not need anyone to vote on it, but we need agencies. We need as much support as we can get. So whoever is in the governor's ear, other legislators, which are, let's say, his coworkers, we need them to talk to him. We need them to support us. We need them to write letters to him if they need to, and show that they're behind us on this. Stakeholders would just be anybody who this affects, patients, current students that are trying to apply to CRNA school, and in the future, if this is their career, it's going to affect them. Schools that are offering DNP CRNA programs, it definitely affects anyone who's entering the profession, thinking about entering the profession, anyone who receives care from this profession as well. And hospitals who don't have to pay CRNAs as much money to do what anesthesiologists do, they should be behind us on this and try to get the same care at a lower cost. It's definitely a benefit to the hospitals as well. So our two main opponents here that we have identified are the American Medical Association and the American Society of Anesthesiologists. The American Medical Association has been a very big opponent. They have basically gone above and beyond to show that CRNAs are just not competent enough, and that is a huge insult. If they're saying if you're not an MD or DO, you're not a doctor and you cannot practice as such or to the level of such, and you're basically inferior. In 2017, the AMA stated that it would identify and review data regarding the type of complexity of care provided by CRNAs. It also claimed that it would advocate for policymakers and insurers to consider this data before making policy decisions. To date, the AMA has not been able to produce reputable data to the contrary of CRNA's practice. Thank you. The AMA has stated that CRNAs should not be viewed as leaders and should merely serve as complements to physician services. This is just insulting. The American Society of Anesthesiologists would be the other big opponent I discussed, and their standpoint is to oppose independent practice for healthcare professionals who are not MDs or DOs. So we've identified what the problem is. We've identified our goals, who our opponents are, and our target audience. The next thing we want to discuss is who are our supporters, and this is quite nice. There's just so many. I'm going to name just a few who are big, of course, specific to Florida. So in Florida, we have the Florida Association of Nurse Anesthetists, which is FANA. The American Association of Nurse Anesthetists is basically the national version of that, and it was founded just a little bit earlier. Another supporter is the National Council of State Boards of Nursing, NCSBN. And the other ones are just various nurse anesthesia programs, including teaching faculty and students throughout the state of Florida, such as Florida International University and the DNP CRNA class. CRNAs and SRNAs, of course, and patients in the public who, of course, this is going to affect them, as we discussed earlier, by giving the option of high quality care at lower costs. The next step would be to get the key messages out there. And we have to identify what these key messages are. The key messages are, well, healthcare in the United States is changing, and clinical practitioners whose services result in cost-effective, high-quality care with safe outcomes will be needed more than ever. This falls under what we discussed about the healthcare reform, which is what they want. The cost to hire multiple providers to do the same job is absorbed by various public programs in the healthcare system and is money that could be allocated more efficiently. Scientific research on outcomes and values should be the guide to determining healthcare policy, and that's true. If there are no differences in outcomes from CRNAs and anesthesiologists, that alone should be a very, very powerful evidence used to make this decision. The next step on our advocacy action plan, so we've the last thing we discussed was supporters and then key messages. Now that we have identified, the problem, the goals, our target audience, our opponents, our supporters, and our key messages, now we need to strategize on how to get this plan completed and done effectively and successfully so that we achieve those goals. So first of all, as mentioned when I first started this portion of the video, this plan is to be done in a 60-day timeline of activities, which would be discussed a little bit later what it consists of, but we want to do this in 60 days. We want to send information to CRNAs and SRNAs and ask for their support and participation in advocacy. Just because they feel the same way we do, in silence, we need to have them actively support us. We want to gather key information, develop the fact sheet, and notify all FANA members of the fact sheet in favor of the Florida opt-out, and then get the word out via mail or email to this group with the fact sheet. We want to ask CRNAs and SRNAs to submit a public comment letter expressing support for Florida as the next opt-out state and urging Florida's governor to choose in favor of opt-out. Again, the governor is the one who can make this happen. We really need to urge him to do so and give him all the support and the evidence that shows that this is a decision that he needs to arrive to. The other way to get the word out basically to anybody and everybody is hold outreach events and meetings. We want to send letters to legislative officials, again, to gain their support, senators and representatives, and we want to meet in person with them if possible. We will keep a strong contact list. So whoever we speak to that's kind of higher up there has some authority and a lot of influence, a lot of pull where it matters. We want to keep a contact list so we can kind of follow up with them. We want to maintain contact with these key supporters, such as the ones with, like I mentioned, strong connections and affiliations with other members of Congress. And we want to get, find local television and radio stations that will interview campaign volunteers. That would be a great way to get the word out there. And being active on social media is huge. Nowadays, that's what everybody does. Just goes on social media and that's how you find out everything. So being active, kind of having like a person that's in charge of this at least. Being active on social media, get about the issue, spreading awareness, and engaging potential supporters through social media. Contact, send letters, emails, meet with various hospital administrations, gain their support, and ask them to write letters to the Florida governor urging to make Florida the next opt-out state. And once we have done all that and the plan has been implemented, we need to evaluate that plan and we need to monitor progress. It doesn't mean anything if you do something and then you don't know if it was successful or not. So we need to continue to reach out to members of the state of Florida, follow up with legislative officials on the status of and progress of the issue, stay in contact with the key supporters, and then continuously reevaluate this plan that you basically have already done, and change anything that needs to be changed, add anything that needs to be added, and just continue to evaluate your progress and see where you stand out with the issue. So that's it for the actual advocacy action plan. Thank you very much. Again, my name is Natalie Cruz, and I am a member of the FANA RORY group for Opt Out Florida 2018. Thank you.
Hello everyone, my name is Santiago Rios. I'm with the FANA RORY group, and I'll be presenting the public comment period statement and fact sheet in favor of the Florida opt-out option for CRNAs. To ensure Floridians have access to high-quality health care, the FANA RORY group has issued a proposed rule for public comment that would empower certified registered nurse anesthetists with full practice authority by allowing the state of Florida to opt out of physician supervision. This effort supports the safe and effective care that CRNAs provide to Floridians. The proposed rule will be open for public comment for 60 days from the date of publication. As part of the process to move the proposal forward, it is critical to involve the public, organizations such as ANA and FANA, CRNAs, and other stakeholders to support this change of opting out and grant full practice provider status to Florida CRNAs. The FANA RORY group welcomes and encourages everyone to participate on this proposal. To comment on this proposed request, please visit the FANA website. Facts. 1. CRNAs are highly educated registered nurses that are trained to deliver anesthesia in any setting and by any technique. 2. There are more than 42,000 CRNAs in the United States that deliver more than 32 million anesthetics each year. 3. CRNAs are the main anesthesia providers for our military and our veterans here at home. 4. CRNAs are the main providers for anesthesia care in rural hospitals and in some areas of the country provide 100% of anesthesia care. 5. Research demonstrates that CRNA's practice is as safe as anesthesiologists. 6. The CRNA-only model has proven to be the most cost-effective model of anesthesia delivery, by about 25% less than any other model. 7. To date, 17 states have exercised the opt-out option, permitting CRNAs to practice independently. This has allowed the public to have greater access to care while maintaining safety and minimizing cost. Thank you.
Hi, my name is Maria Eloisa E. Ortega, and I will be highlighting the timeline of activities for the Advocacy Action Plan of SRNA and CRNA for opt-out in the state of Florida. Week 1. Assign responsibilities among volunteers. Brainstorm with volunteers possible relationships to each organization in the state of Florida. Week 2. Become familiar with the state of Florida lobbying regulations. Identify a primary point of contact from Florida Association of Nurse Anesthetists who will be able to follow on ongoing issues. Week 3. Gain perspective from many sources. For example, members from other professional organizations and stakeholders. These may include, but are not limited to, Florida Nurses Association, Florida Hospital Association, medical societies, and the South Florida Council of Advanced Practice Nurses. Week number 4, request an appointment with the governor via email, formal letter, or phone. The most effective way to influence a politician is to meet them in person. Within the same week, the assigned volunteer should prepare for the said meeting. Week 5, the meeting with the governor should transpire within this week. The assigned volunteer to meet the governor should bring a copy of the fact sheet to present supporting CRNA profession to practice without physician supervision in the state of Florida. Within the same week, we will engage the local media. Contacting the local media will help increase or spread awareness about the advocacy. Week 6, follow up after a meeting with the governor. Send a thank you letter to the governor for accommodating the volunteer for a personal meeting. Outline the position again and reiterate the advocacy group's wish for the governor to support the advocacy. Week 7, establish rapport with the governor and his team, as well as members of other professional organizations. Week number 8, share progress of the advocacy to the governor and his team, as well as members of other professional organizations. Stay in contact with them and update them and educate them about the advocacy group's programs and concerns throughout the 60-day period. Share progress of the advocacy with members of Florida Association of Nurse Anesthetists or FANA, other supporters, and stakeholders.
Hello everyone, my name is Yesenia Canciobello. I'm a member of the FANA RORY group. Today, I'm presenting to you guys in support to our proposed advocacy action plan that our group created in order to benefit CRNAs and SRNAs. This has been done with the intention to convince our audience and our governor, Rick Scott, to allow the Florida state to opt out from the November 13 rule and to allow CRNAs to practice fully independently. This plan that we're presenting to you today is to be implemented over the next 2 months. Some of the different objectives covered are gathering stakeholders to support our project, developing a list of responsibilities for CRNAs, and also witnessing a CRNA to practice fully independently for the next 2 months and evaluating the outcomes. Having CRNAs practicing fully independently without any attending supervision offers a great community advantage, quality of care, and helps reduce costs of our facilities. Being able to allow CRNAs to practice independently is a great advantage to a healthcare system. It is clear that the quality of care that they deliver is qualitative. CRNAs have all the competence and the ability to perform to their full extent of their knowledge and experience. Please support this implementation of this action plan that we have created and help us help CRNAs in the state of Florida to practice independently. Thank you very much for your time. I hope you enjoyed this presentation. Bye.
Hello, my name is Cyndie Castroman. I'm going to be speaking about frequently asked questions on the November 13th rule on the state's right to opt out. What does opt out mean? The term opt out refers to the 2001 decision made by the Center for Medicare and Medicaid that allows states to opt out of federal supervision requirements for certified nurse anesthetist. Does Florida opting out mean that CRNAs are able to prescribe medications? No. Florida opting out does not give CRNAs full prescriptive authority. Why do CRNAs have different privileges in different states? CMS feels that they should not be the ones to set standards, guidelines, or criteria for consultation processes used by any state. They feel that the state should have flexibility to develop a process that works best for the particular situation and their unique need. CMS feels that it is their job of the governor to determine what is considered consistent in that state. Why do barriers exist for nurse anesthetists in regard to Medicare reimbursement, even though legislation has passed direct reimbursement rights? CRNAs are required to work under a physician supervision for reimbursement to be in full effect for Medicare Part A. Nurse anesthetists have been practicing independently for 150 years. Why has legislation changed in recent years? Pressure is being placed on governors for opting out. A federal Medicare Part A physician supervision requirement for facility reimbursement because physicians are attempting to block the efforts aimed at having CRNAs practice independently. What states have opted out at present time? The states that have opted out are Alabama, California, Colorado, Idaho, Kansas, Kentucky, Minnesota, Missouri, Nebraska, New Hampshire, New Mexico, North Dakota, South Dakota, Washington, Oregon, and Montana. How does the state opt out of federal supervision requirements? The state's governor must submit a letter to CMS stating that the governor has consulted the state boards of medicine and nursing. It also has to be determined that it is in the best interest of the state's citizens to opt out. And finally, opting out has to be determined that it is consistent with state law. How does opting out go into full effect? An opt-out is effective once the governor has submitted the letter to CMS. After, the state is considered an opt-out state. Thank you.